Okay, this morning or today we're going to be going over how to do NG insertion and then also how to remove an NG, nasogastric tube. And so the first thing that we're going to do is we're going to go to the nurse's station, and I'm going to be looking at, I'm pulling up my chart, so we always want to make sure we have a physician's orders. So I've got Anna Taylor, date of birth 4/24/1991. She's not allergic to any kind of medication. She's here for uncontrolled diabetes 2, abscess to the abdomen and the right forearm. And so I've already checked all my other orders when I came on shift, but I'm looking specifically for my order. And it says insert an NG tube now. And so we're going to be putting in the NG tube. I'm also going to be looking in my chart to find out with this, it looks like they're going to start a feeding later after we get this NG tube down, but she also has a PEG tube. So we would determine whether or not, looking in the chart, or is this, we're going to be connecting it to suction, which it would tell us if we're going to do that feeding. But also I'm looking in the chart to see, you know, has my patient had any problems, or client, with any kind of respiratory problems? What kind of problems are they having with their abdomen? And because we're going to need them to extend and flex their neck, do they have any kind of range of motion problems as well? So once I've looked at the chart, I'm going to go ahead and look at my policy and procedures. And so with the policy and procedures, I'm just going to make sure that, you know, what does the policy say, and if there's any problems with my, you know, what we need. So once I've checked the doctor's orders, I've looked at the chart itself, looked at my policy and procedures, I need also, when I'm looking in there, what are my patient's learning needs? How does my patient learn? Because I'm going to need to be teaching them about the NG tube, the purpose of it, and, you know, making sure they don't pull it out. And so what are their learning needs? I'm also going to be looking at, am I going to need help in there? Or are we going to have any kind of PPE if they're on any kind of restrictions or anything like that? So I'm also, and I'm going to be doing this during my procedure, is looking at any kind of respiratory problems. So do they have any respiratory distress, coughing, choking, gagging, any dyspnea? And then I'm also going to be assessing, and that's pretty much if they have it before, but primarily during the procedure. Then I'm also going to be assessing the abdomen. I'm going to be looking, inspecting, I'm going to be checking for distension. I'm going to be looking for firmness on the abdomen. I'm going to be looking for any kind of tenderness. If they are distended, then we can always use a measuring tape, belly button to belly button, to check for the girth of our patient, because that's one way we can tell if the NG tube, if they were distended, if that is helping by the measurement of the girth, okay? With anything, we always want to make sure we have good lighting, and so once we have checked doctor's orders, we're going to go to the, so I've looked at that. I'm going to go ahead and shut down my computer for HIPAA. I'm going to go to the supply room, and I'm going to get all my supplies. I've got some tissues. I'm going to have a cup with a straw for my patient, an Emerson basin. I've got my irrigation set, which this one is intact, and it's sterile. The expiration date, it has a 20 mil, because I need either a 20 actually it's 60 mil. So 20 to 60 mil, 50 mil slip tip catheter. I've also got my NG tube, gastric Salem sump. It's a 16 French, so that's something I need to know, because that's what I'll document at the end. And I'm just checking to make sure that the package is intact and that it is still sterile. And then I will need a blue pad. So I've got my blue pad. I'm going to need my either normal saline or my sterile water. In this case, I've got my sterile water. So with it, I'm going to be checking my expiration date, and it says sterile water on there. I'm also going to be needing lubricant. I'm going to need some paper tape in this, but in the hospitals they have securement devices, and so I will make sure I have the correct one of those. Sometimes you may need a tongue blade if we need to look in the back of the throat and we can't see just with our pen line. I've also got my pH piece of paper so that I can, and it starts in increments of 0.5, and this is for human, so we want to make sure for human gastric content. I have my Lopez valve, and I've got my test strip, so that we can, because we want it to be 5.5 or less when we get in there. I also have, I would need to know if I had suction tubing. We would want the extra long in there. If we didn't already, we would get that with us. Okay. I'm going to get all that put back in here. So once I have all of my supplies, like I said, we needed good lighting. I'm going to go, and also I need a pen light. I've got my stethoscope, and I need a marker. This is a permanent marker, so that we can check our measurements and stuff. So I've got all of those supplies. So now that I've got all that, I'm going to go ahead and take my supplies, and I'm going to just step right over here for just a minute, and we're going to the patient's room. I'm going to knock on the door as I enter. I'm going to go ahead and do a medical hand wash. Now, at the lab in Levelland, you actually have, and you would get your hand sanitizer. So we're going to wash our hands, and as I do that, I'm going to introduce myself. Good morning, my name is Jan Bucks-Kemper. I'm a registered nurse, and this morning the doctor has a couple of things that he wants us to do, so I'm going to pull up my computer. And so first of all, I need you, can you tell me your name and date of birth? Anna Taylor, date of birth 4/24/1991. And I've got Anna Taylor, date of birth 4/21/1991. And are you allergic to any kind of medications? No known drug allergies. Okay. Now, you're not allergic to any kind of drugs, but are you allergic to any kind of adhesive tapes or anything like that? Anything that's not medication-wise? No? Okay. And on a pain scale of 0 to 10, I know we had checked that earlier today when we did your assessment and your vital signs, but on a pain scale of 0 to 10, 0 being no pain, 10 being the most pain, what would you consider your pain level? Okay, a 3. Okay, and so I would go through Caldera, the characteristics, onset, location, duration, exacerbation, what relieves it, does it radiate, and if there was any kind of associated signs and symptoms with that. So we've already gone through all of that. Okay, so one of the things I'm going to make sure I've provided for privacy, ask anybody to come out. I'm going to go ahead and raise the bed to a good working height. And now, we are, as I was saying, we're going to be putting an NG tube down. And so the doctor wants a tube that's going to go in one of your nostrils, that's going to go in the back of your throat, and it's going to go down into your stomach. And so in this case, it could be either we're going to connect it to suction, maybe to feeding, which according to the order, we're going to do that later, or just to in case you need it, and we're going to give medications too. Sometimes they do that as well, okay? So do you have any questions for me? Okay, well there's a couple of things that I need to do. I need to make sure that I've got my suction container connected here. And I'm just going to go ahead and get my stuff out. So I'm going to need a Emerson basin and a cup for them to sit. Also need this for them to do that. So it's going to give me just a minute to get everything ready here. Okay. And I've got my, I'm going to go ahead and, I'm going to go ahead and get all this stuff out. Get it set here. Lopez valve, extra. We've got those. Water. And I'm going to go ahead and open up my kit. Okay. The other thing I need to do, I'm just going to walk right over here and I'll get that just a second. So once I get all this connected here, and my lubricant, okay, don't necessarily need that right now. So I think I've got everything. So I've got everything here that I need. And so I'm going to go ahead and get my trash over here, and I've got a biohazardous bag, putting any kind of supplies in there and disposing of it per hospital policy and procedure. So because I touched the trash, I'm going to go ahead and wash my hands. And at this point, I'm going to be doing an assessment on you, and so because they've been having some problems with GI stuff, and you can determine whether or not you need to have gloves on to do the abdominal assessment. I'm going to go ahead and put gloves on. So let me get that. So I think I went ahead and already got the bed into a good working height. Like I said, we've provided privacy, and we're going to start with you laying flat so that we can assess your abdomen. Okay. I'm going to go ahead and put this rail down. Normally, with the other hospitals, the beds, you wouldn't necessarily have to do that. I'm just going to uncover the abdomen, making sure that I maintain privacy as we do this. Oop, got your hand caught in there. Okay, so first of all, I'm just going to inspect the abdomen and see if I see anything unusual. I do note that they do have the peg tube up in the left upper quadrant, and with that, I'm going to go ahead and get me some alcohol swabs. A couple of that. I'm going to clean my stethoscope. So we've inspected, and I noted that you're not really having any problems breathing, you're not coughing or anything like that, okay? And so we're going to listen to all 4 quadrants, making sure we look at the umbilicus as I'm going to listen. Now, I'm going to just go right next to this over here, still in that quadrant, because I want to be more stethoscope to skin, which is kind of hard to tell with that, but I can still at least listen in this quadrant. And I'm going to look over here in this quadrant and this quadrant. So with you having GI problems, I'm going to be looking to see if you have, is it hypoactive, is it hyperactive, depending on what's going on with you at this moment in time. Okay, so do you have any place that's more tender, or because I'm going to be looking for distension. I'm going to check to see if your abdomen is firm, if there's any tenderness anywhere, and again, we would measure the girth if we need to, okay? So I'm just going to palpate lightly. Just going to palpate around that area right there, okay? Did you have any pain with that? Just a little bit right there? Okay, and we'd already checked your pain level earlier. All right, so once we've done that, we're going to go ahead and cover you back up. And I'm going to put this side rail back up while I get ready to get everything ready. I'm going to go ahead and take these gloves off, glove to glove, skin to skin, and I'm going to go to the wall, get my hand, and do my medical hand wash. And then we're going to put you into a high Fowler's position. I didn't see anything in your chart that made it indicate that you couldn't sit in a high Fowler's. Just need to make sure I've got all the wires and stuff, okay? Now when we get through, once we put this NG tube down, we've got to make sure that your head always stays at least a 30-degree angle, okay? And so I'm going to go ahead and just kind of pull you up a little bit here. And I'm going to put your pillow down just a little bit. So are you comfortable there? Okay. All right, so if I didn't have gloves on to begin with, then I'm going to go ahead and put gloves on now. So we've already done our the medical hand wash. And I'm going to put on clean gloves. Are you doing okay? Good. Okay, so just a few things I've got to get set up. I'm going to have you hold that, and then I'm also going to be having you hold your water here, okay? So you're going to hold your water for me. I'm just going to stick it in there right quick, all right? And get my measuring and my, and I've got my, take my NG tube out. Now, one of the things that we do here is you want to make sure you keep this, because this is a connection for your suctioning. So if we're not going to be using this, but you need to make sure you keep it so you know where it's at in the room so you can connect it. Or you can go ahead and just use that and connect it to your suction there. Okay, so before we go any further though, I'm going to go ahead and put this side rail down. And I've got it to a good working height to get that. Alright, and what I'm going to do is I'm going to just look in your nose, and I'm looking to see, and also looking at skin integrity. I'm going to look at your nose to see which one is more open. So they both look open. Do you have a preference that you have problem breathing out of one or the other one? No? Okay, so we're going to go in this right side here, okay? And so once we've done that, we're going to go ahead and get our NG tube. I've got my tape right here. Let me get it started. Okay. And I'm going to take my tube. I'm going to take this down for just a second so I can find your xiphoid process. So we're going to go from your nose to your earlobe, okay? And then we're going to go down to the xiphoid process, okay? Right there is where we are going to either use our marker to mark it, okay? Or we can use our paper tape, one or the other. So that way we know how far to put your tube in. Okay, so once we've done that, I might give it just a little bit of a twirl here, or the end of that. And next I need to go ahead and get my syringe on, and I'm going to go ahead and put, now this is an air vent, so you never want to put anything there, so I'm going to go ahead and put my syringe on there. Okay, I'm going to go ahead and make sure that I've lubricated my NG tube at least 2 to 4 inches. Okay, So it's lubricated generously. And I'm going to go ahead and put this over here. Okay, so we're going to start with putting this in. I've got my, let me get everything ready here. Okay. To put my device in. Okay, all right, so I think we're ready to go ahead and start putting this in. We've done our assessment, we've checked everything, and so we're going to go ahead and get started. We're lubricated generously. Okay, so what we're going to do is we're going to start and we're going to go up and down the flora of the nasal passage. Okay, so and then as we get back to the pharynx. Okay, so when we get to the pharynx, you may feel a little tickling and gagging or coughing. Okay, and so we're going to wait just a minute. So once we get there, at this point, I'm going to go ahead and have you. So I had your head back on the pillow. Now I'm going to have you put your chin to your chest here, and I'm going to have you take some sips of water. And every time you have a sip of water and you swallow, I'm going to advance this. Now, note that if the gagging and the coughing is persistent and it doesn't stop, then we're going to stop. And if we need to do that, I'm going to hold that right there. I'm going to pull back just a little bit. I'm going to get my pen light, okay? And I'm going to have you open your mouth, okay? And I'm going to look to make sure that the NG tube hasn't curled or coiled in the back. And if it has, I'm just going to kind of twist and get it straightened out. Okay, so it's straightened out now. And so we're going to go ahead and continue. So get your chin to your chest, and every time you take a drink and you swallow, we're going to advance. So swallow, swallow. Okay, keep going. Now, if at some point you start having any kind of, another note is if you start coughing, you're gagging, you're choking, you're showing signs of respiratory distress, cyanosis, maybe you can't, can you talk to me? If that's the case, I would stop and I would remove it, and then I would look to see, according to the policy, how many attempts I can make before I need to call the physician. So, but she's not gagging, she's not having any respiratory problems, and so we're going to continue to advance our tube. Okay, every time she takes a gulp and a swallow, we're advancing that tube. Okay. Okay, so we would do that until we get to our tape here. Okay, some of our mannequins don't let you go all the way in. Let's see. Okay, there we go. You just need just twisting a little bit here. Okay, so every time you took a sip and you swallowed, we would advance until we got to our marker. Okay, so our marker is going to be right here, and so with this patient, this mannequin, we couldn't get it to go all the way in. I need to make sure she's not. You don't ever want to put your hand in their mouth because they can bite you. But so we're gonna. This is all the way up to here, and so I'm going to go ahead and take. And I should have done this prior to, so I need to make sure I hold that. You're going to take your, because remember this has lubricant on it. So you're going to use your securement device. And you're going to put it on the nose. Okay, and we assessed our nose to begin with. We're going to tear this in half. And we're going to take part of that and we're going to go around this side of the tubing. So it anchors it in place. And then we're going to go around this side here. So our marker is up here now, okay? So we've made a note where that marker is. And so once we have done that, now we're going to check to see our placement. So I'm going to go ahead and remove some of the content. I'm going to be looking at the drainage, what is actually coming out. Okay, so I'm going to go ahead and take that. And I'm going to go ahead and I'm going to put this on my here, and I'm going to put that on there. Okay, I'm just going to leave that on there for just now, and I'm going to look to see, and I'm going to measure it. And so it needs to make sure that it is 5.5 or below. Okay, and I'm going to note what it is. And so this one is actually it is 4, so that is good. All right, so we've got that. Now that we've done that, I'm going to go ahead and take this off, and we would, and I'm also going to put the call light on and ask someone to call down to get an x-ray, because we've got to confirm the placement. So those are a couple of things we did. So we checked the pH, and we're also doing a x-ray. Before we can use this, we got to confirm it with our x-ray. So I'm going to go ahead and put my Lopez valve in, okay? And so it has several different stoppers here. So this is the off button right here. And so I've got it off. And we can also cook up suction here if we need to, but we can also connect our tubing for feedings here. So we're just going to make sure that we're off to where we need. So it's off here, so we don't have to have that, okay? So once we've got that in place, and I just need to make sure that this isn't going to be tugging, because again, we inserted it to our mark, and we want to make sure that mark stays where it's at. And now I'm going to go ahead and just get rid of all of my stuff. And so we had them sip and swallow and advance all at the same time, okay? Okay, I'm going to take my gloves off, glove to glove, skin to skin. I'm going to do a medical hand wash. Let's put that side rail up. So we want to make sure we put the bed in the lowest position. I'm going to get the patient comfortable. So side rails up ×2, bed in low positions. The wheels are locked. We've got our call light within reach. Okay. How are you doing? Okay. And I'm just going to go ahead and put your head back to, it can't be less than 30 degrees. Okay. And I can just rearrange that pillow a little bit better there for you. Okay, so are you comfortable? Okay, so we'll wait for that chest x-ray. We've already called for help with that. And I'm going to make sure that I clean all of my stuff up. We will probably be needing this for as we go along, so all of that stuff will stay in your here's the, we probably won't need that, but we'll leave that in here. So we're going to leave that in our cup here, and we're going to date, time, and initial everything that we used. We will need this at a later time, so I'm going to leave that in this cup right here, and just to get rid of all of that right there. Okay, so once we're done here, then I'm going to go ahead and take those gloves off again, glove to glove, skin to skin, do my medical hand wash, and then I'm going to go over here and I'm going to document. So what we want to do is, if we want to let the I'm gonna have to hand wash here. Okay, so we are going to be letting the doctor know. So before I start doing that, can you tell me again what's your pain level? On 0 pain being 0 being no pain, 10 being the most pain. What would you rate it now? Did that help kind of relieve some of that tension on your stomach? So 1, okay, and we would go through our caldera again. Characteristics, onset, location, duration, exacerbation, what relieves, does it radiate, and if there's any associated signs and symptoms. You did really well during the procedure. We didn't see any, it was expected that we went through. You didn't have any problems with swallowing. You didn't have any of the respiratory problems, so we would always want to make sure that we're notifying the healthcare facility if there's any abnormals. We assess the pain, so we would document the pain before. We will assess our assessment before, which was respiratory and our abdominal. Any kind of signs of possible aspiration, which we didn't have any with this one. So our expected was we were able to get the NG tube down. We didn't have any unexpected. We were able to, she didn't have any problems with the swallowing and again respirations. So we're going to document what our assessment was prior to. We're going to assess we had a 16 French nasogastric tube, and we went through the right nair where our mark was on the tubing. Okay, so we need to make sure we document that so the nurses know the next time or every time they come in, is the NG tube still at that same, the length of the tube. And then we also assessed the gastric contents, okay? So with that, we don't need that anymore because we've got this stuff here. And so as I'm leaving the room, I'm going to go ahead and do a medical hand wash. I've closed out my patient's file before I leave the room. Do you need anything? And then, of course, I'm going to make sure I have all of their equipment. I need to dispose of the trash according to the hospital policy. And again, now I'm leaving the room too, and I will do my medical hand wash. Just put your call out on if you need anything, or if you're having any problems. Okay, we are back at the nurses station, and so I'm going to be looking at my orders again. So again, I have Anna Taylor, date of birth 4/24/1991, no known drug allergies, uncontrolled diabetes 2, abscess of abdomen and right forearm. And so I'm going to look at my new order that says to discontinue the NG. And so we will make sure that we have everything that we need. So I've checked the doctor's orders. Again, I'm going to be looking in the chart to see if there's anything that maybe I need to report to the doctor that we don't need to do it, or if there's anything that, again, do I need to have any extra help in there when I do this? My patient's been very cooperative, and so we don't need that. I'm going to check the policy and procedure, and that's something we do with everyone. Again, we're going to be looking at do they have any learning needs, and what types of learning needs? How do they react, and what kind of teaching? I'm going to go. I've got my. I'm going to go ahead and get my supplies and go to. So once I've checked all that, then I'm going to go ahead and shut down my computer. Go to the supply list, and as I'm just talking about it, any procedure, we always want to make sure we have good lighting. And again, we're going to be doing an assessment when we get in there, looking at respirations, which they haven't had any problems, but we're going to look at the abdomen before we actually pull that out. Again, we're going to be looking for distension, any firmness, any tenderness, but we're going to be checking the abdominal girth if we need to. So I'm gonna go, and a couple of things that we're gonna need. We need our adhesive remover. We've got a washcloth and a towel and a blue non-disposable. We've got some tissues. Don't necessarily need tape, but we know that we have our syringe in there. We've got sterile water in there. We've got our pH. We have our solidifier in a basin and a cup. And so once I've gathered all of my supplies, then I'm going to go ahead and go to the patient's room and knock on the door. Come in. Good morning. My name is Jan Buckskemper. I'm a registered nurse, and we've here to take that NG tube out. I know you're ready to do that. So let me go ahead and pull up my computer. And so if you will, again, tell me your name and date of birth. Anna Taylor, date of birth 4/24/1991. Okay. And are you allergic to any kind of medications? I know we ask you that every time, but we need to make sure. No? Okay. Now, before we asked about adhesive, but now we're going to be using some adhesive remover. Have you ever had any problems with that? You don't know, you've not really ever used that before? Okay. All right, so and our order says is to remove that catheter. All right, so a couple of things I've got to get ready. So I'm going to go ahead and put some gloves on. Now, are you in any kind of pain? On a scale of 0 to 10, 10 being the most pain, 0 being no pain, and 10 being the most pain you've ever had, what would you consider it? A 0 right now? Okay. And if it was anything else, we would do our caldera. Characteristics, onset, location, duration, exacerbation, does it radiate, what relieves it, okay, and any associated signs and symptoms. So I know we were supposed to have left your head of the bed up 30 degrees, but for me to do an assessment, I'm going to go ahead and just lay it down because you don't have any enteral feedings going and you haven't had any problems with that. I'm going to go ahead and get the bed at a good working height. Here. Let's use the right one. Usually it's not quite so cranky here. Okay, so we've provided privacy. Now, as I said, we're going to be taking that NG tube out. So the doctor has ordered us to do that, and I will tell you and explain to you everything that we're going to do as we do it. Okay, so I'm going to assess your, do an inspection. Okay, and we're going to go ahead and auscultate now. And hopefully we hear those bowel sounds being about the same, or being regular now. Okay, we're going to do our 4 quadrants, belly button as our guide. Okay, and I'm going to try to get over to see if I can hear. Kind of really want it to be stethoscope to skin, but it's right over, so we'll just kind of do it in a couple of different areas in this left upper quadrant. And I'm hearing sound like they're normal. Okay, good. And so we're going to check to see if is there any place that's more tender than the other? You're getting better over there in that area. Okay, so I'm just going to go ahead and palpate lightly. Let me know if there's any. I'm checking for any tenderness. I'm looking for any kind of distension, which you shouldn't have any. That's our expected now. And looking to see if there was any firmness, and we're soft right now, so that's good. And then if I needed to, I could measure your abdominal girth. Okay, so I think we're good with all of that. I'm going to go ahead and take these gloves off, glove to glove, skin to skin. I'm going to do a medical hand wash. And now with this, we're going to go ahead and put your head all the way back up. We want it to be a high Fowler's if you can tolerate that, but if not, we'll do 30 to 45 degrees, okay? All right, let me go ahead and get some gloves on again. Let me give you a couple of tissues, because once we pull that out, you may want to blow your nose. There's your tissue in your hand there, okay? And I've got the Emerson basin here, in case we need that. I also have my solidifier. I've got my sterile water, and I'm going to go ahead and just going to pour some of that in there. So again, we've checked to make sure the expiration date's what we had already brought in here. And I'm going to go ahead and just pour some in my container, because we're going to irrigate before we take that out, okay? And so I've got that, and just in case we'll, okay, so we've provided for privacy. And do you have any questions before we get started with this? Okay, so we've already checked your abdomen. I'm gonna be checking your marker, okay? So we're checking to make sure you're at the right mark. And it is. So that's one of our, and then we're going to remove. Now, if we were hooked up to suction, we would go ahead and disconnect, turn it off, disconnect the suction, okay? And because we'll deal with that here in just a little bit. So I'm going to go ahead and I'm going to connect this right here. I'm going to have my slip tip, okay, make sure my stop is on the right place here, okay, it is, and I'm going to just aspirate a little bit of fluid, turn that off, okay, and then I'm going to get my, we're going to check it, okay, and I've got I don't have any left. We got just enough that we needed in there. And so we're going to, according to how long it takes, we're going to read it. Okay, we're still at 4, so that means we're still in the stomach. Okay, and so since we've done that, now we can either, to flush it, we can either use our sterile water, or we're going to use at least 10 mils here to do that, or we can flush it with 20 to 30 mils of air. So let me find my 10 mils there. Okay, so there's my 10 mils. Actually, we're going to do 40 of air. Okay, and so I'm going to go ahead and connect that back. And we're going to open that. So we've got the open area there. And we're going to go ahead and flush all of that out, so we don't have any in the tubing when we get ready to remove this. Okay. And so once I've checked placement, I've done that, I'm going to go ahead and use my adhesive remover. And we're just going to make sure we get all of that. And as I'm doing that, I'm checking for the skin integrity. While we had done all this, we had been checking for skin integrity. And then I'm going to go ahead and get a towel. Okay, So I've got that all clear. Now what I need you to do is I need you to take a deep breath and hold it, okay? So take a deep breath, hold it, and I'm going to carefully pull this out. Get your, okay, and we're going to wrap it up down here. Here's your tissue to help with your, just some of that lubricant that was on there. Okay, I'll get you some more tissue, and we're going to dispose of that. Glove to glove, skin to skin. I'm going to do my medical hand wash. Are you doing okay? Okay. Let me get you back in just a comfortable position. I'm going to leave you about right there to begin with, all right? And so what I'm going to do is I'm going to go ahead and give you a warm wash rag for you to wash. You have a tissue to kind of blow your nose if you need to. Here's a warm wash rag to wash your face. And I know since you've had that, we're going to go ahead and offer you to brush your teeth if you need to. Maybe rinse your mouth with some mouthwash. And then I've got some cold water here. Now, if you're MPO, we won't be able to give you anything, but you were able to tolerate that. So we just want you to take a little bit of a sip, okay? Just it's a little cold water, just a sip to kind of help with the dryness in the back of your throat, okay? All right. We don't want you to take much, just until we make sure that you're not going to get sick at your stomach or anything since we took that out, okay? So are you feeling okay? I'm going to check your nose to make sure that there's not any bleeding or anything like that. And you've got your Emerson basin there if you need to, and your tissues over there. Okay, so once I've taken care of my patient, got them into a good, comfortable position, I'm going to be putting the bed down into the lowest position, side rails up ×2. Call out within reach, making sure the wheels are locked. And now I'm going to go over here and I'm just going to be assessing the drainage, okay? How much, I'm going to be measuring, get down eye level, and so with each shift we were measuring, and so I would deduct from the last line to today, so I knew exactly how much, so I can document I's and O's, document what that is. Now with the I's and O's, if I had flushed with the normal saline, I need to subtract, however much I subtracted, I need to make sure I subtract that from the amount, because we want to know what the output was, and not that. So once I've done all that, I'm going to use my solidifier, open the lid, put the solidifier in there. The solidifier makes it a gel, like Jell-O, so that whenever you take and you unhook everything and you put it in your biohazardous bag or whatever the hospital's policy is, then it's not going to go everywhere if it does. So glove to glove, skin to skin, again do a medical hand wash. And then I'm going to step over here, and again, I need to document. Okay, so in my documentation here, just as we did before, we're always going to be making sure that we notify the healthcare team if there was any kind of unusual or abnormal findings that we had there. I'm going to be looking at the that we removed the we did our abdominal assessment, so we kind of go back through. We did our abdominal assessment. We did our, that we removed it, that we checked the marker. We checked for the the gastric acid. Now, are you any pain right now on a scale of 0 to 10, 0 being no pain, 10 being the most? You're not in any kind of pain right now? Okay, good. And so we want to make sure we keep your bed elevated just for a little bit right now. Anything that was unusual, our abdominal assessment, that we removed that. If you had any problems with, looking at my documentation here, to see if we have anything else that we need to report. We talked about the drainage, we talked about how they tolerated it, okay, with minimum pain. And then we always want to make sure that you need to verbalize this out loud, that we're going to come back in within 2 hours and we're going to do another abdominal abdominal assessment. Now, if you are having any pain or anything before then, just let us know. So we'll do that every 2 hours just to make sure you're not getting distended again. And then we're going to, while we're doing that, check to make sure you're not getting distended. And then also we're going to make sure that you're not having any nosebleeds, because that's something, because when you have that tube in there, your nose kind of gets a little dry, even in the back of your throat. So we want to make sure we're not having any bleeding or anything like that. So once I've got that all documented, then I'm going to go ahead and we're just going to put some clean gloves on, and I'm going to clean up your area. We've made sure that the bed was in a low position. The side rails were up ×2. The wheels are locked. Your call light was in position. Yeah, okay. And I'm going to leave and remember, you're just going to be sipping on that. And so we would get all of our supplies and dispose of those down in. Now, this would stay with the patient. This would be gone because we've already put it in our, I'm going to leave a washcloth here for you, and then we would dispose of all of these. So we don't need that. That's mine, and so we'll clean that. Just make sure you have a clean, dry spot. I put this on the back side of the table, and I'm going to make sure this is close so that you can get to it. Here's some extra tissues if you need it. And so glove to glove, skin to skin. And I finished my documentation. I'm going to, before I touch that, go ahead and wash my hands. And then, is there anything else you need? Do you have any questions? Are you having any problems right now? No problems with your breathing? Your abdomen feels okay? Okay, so I'm going to go ahead and get ready to leave the room if you don't have anything. Okay, so I'm leaving the room and I'm going to walk out doing a medical hand wash.